As yet, there is limited evidence about the long-term effects of COVID-19, but lots of people are reporting a range of unpleasant symptoms many months after their initial illness. It's been coined long COVID, and it's unclear how many people are affected by it. But just what is it? And how should policymakers respond? Our health correspondent Deb Cohen reports.
A COVID patient is clapped out of Sutton Coldfield's Good Hope Hospital after 23 days. The patient is Phil Cawkwell, in normal times an anaesthetic assistant at the hospital. Pre-COVID, Phil had been cycling 100 miles at a time. But despite his fitness and his youth, he struggled to shake the virus back in April and ended up very ill.
So now I'm by myself in my house, knowing full well that I'm now day 7 of my illness, and normally day 7 to 10 is when you either get better or you don't, and I weren't getting any better. So I wasn't panicking, but I was aware that I know the pathway. When I got into A&E, the critical care team arrived, so my direct colleagues came down. And although they were wearing PPE, I could see they had fear in their eyes, which didn't really scare me. But if they were scared, then I maybe should be a little bit scared. And I just felt like this is it. This is my days are done now.
One of those treating Phil was his colleague, Dr. Ron Daniels, an ICU consultant.
When Phil came in, of course, we were all shocked. We were all worried for him, and you know, we knew we had to protect him, so we couldn't descend en masse, and we couldn't all go and visit him several times a day. There's the emotional connection. You know, this is not just a colleague that you bump into at work from time to time. This is someone that we'd all worked with for many, many years.
Phil survived. He left hospital after 23 days, but life is far from back to normal.
I'm living like almost my worst nightmare, possibly. It's certainly up there with worst nightmares. I dread waking up in the morning. I feel breathless talking. I feel like I can't breathe out. I've got a tremor, pins and needles in my hands. My quads feel like glass, like they're shattering every time I'm walking. Just the pain, and then top it all off, I've got this fatigue. So I'm in agony and I'm knackered all the time.
People who have effects from COVID after they've recovered from the acute illness have what has been coined as long COVID. Sometimes people who have serious infections can take a long time to recover.
Actually, these symptoms are not new. We've known that people who survive sepsis, and whether that's bacterial or viral sepsis, end up with these very similar psychological, cognitive and physical after effects. So it's not new as an entity, disability after severe illness. There might be nuanced differences between COVID disability or post-COVID disability or long COVID and other forms.
One problem is there is no specific diagnostic criteria for long COVID. It's not a well-defined term. There isn't much published evidence about what it is, so researchers have drawn on people's experience. So what is long COVID? Early work has come up with 4 types or syndromes. Post-critical illness syndrome, people who have been admitted to hospital and taking a long time to recover. Post-viral fatigue syndrome. This is people who have symptoms and is similar to what people who have ME report. People with organ damage, some may have damage to their heart, lungs and kidneys. Long-term COVID syndrome. This is people who have mild symptoms at first who may later develop other symptoms, such as a headache or a racing heart or breathing difficulties. One problem is that other than people who have been in intensive care, it's not clear who may be at particular risk.
We don't think it's a linear disease that is more severe in people who have very severe acute symptoms. The challenge is that there are different expectations in the health services about what defines long COVID. So people are presenting either to helplines or health professionals and saying, these are my symptoms, but they don't fit a predetermined set of expectations of what long COVID is. So they're not being believed and they're not being offered help.
Phil's story, and those of many other long COVID sufferers, is something else for policymakers to grapple with when balancing the impact of this coronavirus with people's general well-being and keeping the economy afloat. The question is, how much weight do you give long COVID?
One problem is they don't know how prevalent it is.
The difficulty in defining the prevalence is, how do you define what is long COVID? It's such a vague term. We know that a lot of people didn't get tested in March, April, May if they weren't in hospital, and some of them didn't get access to a GP. So there's no record of them having had COVID. So how would you know who to approach to ask if they got symptoms? So it is an epidemiological conundrum.
Well, I think the first thing to say is that we have to be conscious that this is real, but I think we have to balance this with the risk to the population as a whole in terms of the consequence on other conditions, the consequences on mental health, not to mention the economy. And we've known from people with sepsis for many years that these symptoms tend to improve with time. So it's not the case necessarily that people with long COVID are going to be debilitated for the rest of their lives. They may be debilitated for a number of months, and of course that's awful. But there are the other consequences of a continued focus on a single condition.
Well, it's day 5 of COVID-19.
But to Phil, COVID's harms are not something we can live with.
In my opinion, we have to eliminate the virus to live in our society. We have to completely suppress the virus. COVID-19 is a real threat to people. It's ruined me.
Like so much related to this virus, long COVID remains an enigma, its impact still hard to quantify.